Wonderful. Thank you, everybody. Thank you to the last panel, and thank you for the very sustained crowd that we have here in the afternoon. We are going to move on to goal area 5, which is every child has an equitable chance in life. We will have the initial presentation by Alexandra Yuster, our Associate Director of Social Inclusion, and then we'll move on to our panel for your questions and discussion.
Good afternoon, everyone. Goal Area 5 focuses on equity, our efforts to make sure that the most marginalized children aren't left behind. And this work contributes both to reducing poverty and discrimination and increasing participation, all of which are ends in themselves, well established in both the Child Rights Convention and the SDGs. And it also makes a clear difference in children's lives by contributing to all other rights, whether that's health, education, protection, indeed WASH. So let me show you a little about how this works with some examples of our results across social policy work, as well as the cross-cutting areas in adolescence, disability, and gender, which are also covered by this goal area. And I'm going to make some reference to quantitative results too, but would be way too much to list. So you can find much more about the quantitative results and lots more examples in the report, so I hope that you will take a look. UNICEF's child poverty work helps countries to meet their SDG commitment to measure and to reduce child poverty. And so far, progress is fastest on measurement. 55 countries now measure multidimensional poverty, and 74 measure the monetary kind, while only 16 have made child poverty central to their national development plans. So guess where we're focusing now? We're shifting our attention to focus on helping countries to put that data to work. And let me give you an example of how that was done and what difference it made to the lives of the family that you see here in Georgia. So this is Natia and her family, and they live in Tbilisi in Georgia. And when Natia's son Sone was born with a disability, the family's finances faltered. But fortunately, the government's social protection programs did help the family to stay afloat. How much families receive in such programs matters. And recent child poverty work undertaken by the UNICEF office in Georgia in 2018 ended up leading to a 5-fold increase in the amount of money that such families would receive. So how did that happen? Well, there was growing concern in the country about increasing child poverty rates, despite the fact that the country had a child benefit. So UNICEF and the government teamed up and did an analysis which showed that the benefits were actually helping, but in fact, child poverty would be twice as high if the benefits weren't there. But at the same time, they weren't enough, and thus child poverty was still going up. So the resulting debate about this and the clear evidence that we had in hand led to the government's decision to increase the value of the child benefits from about $3.50, translated to US, to $18 a month. And that's making a difference now in the lives of 130,000 children in Georgia. So there's lots more examples in the report. I just want to quickly mention 2 more. One is Argentina, where something similar happened, but and the amount of funds that were provided, rather amount of funds available for the Child Grant Program was increased. And this money was increased with, interestingly and thankfully, the blessing of the IMF. Not always necessarily the case, but the IMF understood that the impact of the program that was being placed on government was such that you needed to create a floor under social spending. And this was a great place to start. In Iraq, some great work undertaken with WFP to support innovative approaches to measure child poverty, and then with UNHCR to help the government improve the flagship cash transfer program using multidimensional child poverty data. So what I'm trying to say is that this rather seemingly technical work ends up translating into more money in the hands of families who need it the most. And as you'll see a bit later, it also helps ensure that money is invested in the services that such families need, giving the poorest kids a better chance of accessing health, nutrition, education, and protection services. I think it's worth mentioning that it also can simply mean more time for families to spend with their children, to get the attention and love that they need. And you can see that on the faces of Natya and her children here. We've already started talking about social protection a bit, but I'm going to talk a bit more about this really crucial area of our work and the largest area of expenditure in Goal Area 5. And we know that social protection can make a difference today and can help today, but it can also help protect families against future risks, especially when social protection systems are improved to respond to crises. And you may know we focus especially on cash transfers, including in humanitarian contexts, as you can see in the chart, the number of children reached. But our social protection work also aims to improve systems overall, including programs that help families to access healthcare and other services. So let's take a look at how this helped to improve the lives of Mariam and her family in Mali. Mariam and her family benefit from a non-contributory health insurance program called Ramid, which gives them access to a wide range of free healthcare services. UNICEF helped the government launch and develop and launch the program back in 2015. So why am I talking about it now? In 2018, our work helped to lead to a 6-fold increase in the numbers of families who are eligible for Ramid. And while that number is still small, at about 20,000 families, it is a huge difference in the lives of those families, and it continues to expand. The expansion that happened now was aimed especially at the poorest regions, including Kayes, which is the region where Mariam and her family live. And the way that we did this was by helping to develop a single registry, which makes it easier to link the cash transfer program, supported by the World Bank, with whom we partner, with Ramid, with the health insurance program. These links make programs more effective. You help make sure that the people who need help the most get all the services and all the supports that they need. And it's especially important in countries experiencing conflict and fragility like Mali. And this is a good example of how you can help support both material needs as well as the services that families need. Let's move on now to our work on public finance. And here, I really want to emphasize that UNICEF's work is not simply about spending more. The idea is to help governments to spend smarter on children, for education, for health, for nutrition, for protection, and for WASH. And it's not just about how much. It matters that that money is spent on the right goods and services and that these reach the poorest children. So here's how this worked in Cambodia in 2018. As you may know, malnutrition is a serious problem there. About a third of kids under 5 are malnourished, and 10% suffer from severe acute malnutrition. And while many factors, of course, contribute to this, it was clear that better managed finances for targeted nutrition programs could help. So UNICEF conducted a study collaborating with the World Food Program and the Ministry of Health, which estimated the economic burden of malnutrition at $266 million annually. And then we teamed up with the Ministry of Finance and did further analysis on the national expenditure on nutrition. And guess what we found? That less than 0.01%, not of the government budget, of the budget just of the health ministry, was being spent on nutrition. And that was being mostly to buy an expensive imported milk-based protein product to treat severe malnutrition. But they couldn't afford to buy very much of it. It also found that the health ministry's weak budget planning capacities weren't particularly helped by the fact that finance hadn't asked ministries to prioritize nutrition in their budget. It's a technical detail, but it matters, and that adds up to the 0.01%. So a third piece of the puzzle was a cost-benefit analysis by UNICEF and the Ministry of Health, which showed that a locally produced fish-based protein was equally effective and significantly cheaper than the imported one, and could save the ministry up to 30% of its nutrition budget. So, okay, did all those studies sit on the shelf? They didn't. Nutrition was finally designated a budget priority by both finance and health, and there was a 30% increase in nutrition allocations. the procurement of the expensive milk-based protein stopped, and the more effective locally produced product was purchased, and they could buy much more, enough to fully meet the demand. And finally, that product is now being successfully distributed to the most deprived regions where the product was needed. You might not have thought that economists could do something about hungry children, but it is possible. Let me move now to disability, another crucial area of the work of Goal Area 5. In 2018, amongst the children that UNICEF reached was 9-month-old Danilo, who you see in this photo, who lives in Guatemala City. He's here with his brothers. Danilo was born with congenital Zika syndrome and was with microcephaly. Danilo's parents told us that the doctor said, oh, we shouldn't get too attached to our baby. They just said he was essentially a potato, one that had been poorly cooked. Fortunately, Danilo's parents were undeterred, and Danilo now attends a center where he plays and gets therapy, and where his parents are supported to create a loving and stimulating environment for him. Part of UNICEF's overall support to the health must be there to improve early intervention. UNICEF helps governments and communities to strengthen services to be more inclusive of kids with disabilities and to break down the barriers that create stigma and negative attitudes. We're also working to ensure that kids like Danilo are not invisible. This matters. Having the data, knowing where kids are matters. And so making sure that they're counted in demographic surveys as well as national information systems is also crucial to our work in this field. So by receiving this intervention and care and support at a young age, Danilo is far more likely to go on to receive an education and to get other services and the assistive devices he may need as he grows older. In 2018, UNICEF provided over 66,000 children with such assistive devices, products that support their mobility, communication, and independence. And speaking of independence, let's move to adolescence. So what is adolescent civic engagement, and why does it matter? We find ourselves asking this question, and this has been an area that UNICEF has worked to engage in for quite some time. But it's clearly a sign that far more needs to be done to promote work in this area with donors, with governments, with schools, community members and parents, and even adolescents themselves. So at UNICEF, we define civic engagement as any activity that adolescents may lead or become involved in that aims to improve their community, school, environment, state, or country, including development of a combination of knowledge, skills, values, and motivation. So say hi here to Mahmoud. He's a 13-year-old and he lives in Zatar camp in Jordan. Mahmoud noticed that his neighbor's daughter, who'd been injured in a mortar explosion, was housebound, and he wanted to help. So he took part in the Changemakers Lab, which aims to equip vulnerable youth in Jordan with the knowledge and business skills needed to design their own solutions to everyday challenges, and promotes entrepreneurship and jobs. Mahmoud designed a simple wheelchair, and he hopes that it can be reproduced at a low cost. I like this story for a lot of reasons, but in particular, it shows how these equity-focused interventions reinforce one another. And I think you may have noticed that in some of the other stories that I've told you so far. Finally, to say, too often we hear only negative stories about the risks adolescents take or how they may cause problems or violence. But supporting adolescent civic engagement can open people's eyes to immense positive energy and creativity that young people can bring to their communities, if only they're given the space, skills, and opportunity to do so. And finally, this slide is going very slow. I'm going to put it all up at once for you. Oops. In 2018, UNICEF also put more focus on concrete efforts to support positive gender socialization, to change discriminatory gender norms, which we believe can then help achieve equitable outcomes across all rural areas. This involves changing norms in communities, in families, in faith-based organizations, and schools to value girls and boys equally and to widen the horizons of what each can do and what each can be. So Juan Carlos, in the picture here, lives in Cuba. He's a 42-year-old dad. And he came across a program called Farther from the Beginning, created by the Ministries of Education and Health with UNICEF support. The campaign creates awareness amongst mothers and fathers about the rights, responsibilities, and benefits of equally shared parenthood. And I know this is particularly a nice picture to see, and unfortunately in 2019 still all too rare. So through this program, Juan Carlos learned about free childbirth classes he could attend with his partner, Maria, and they also found out that Juan Carlos could be by Maria's side in the delivery room when she gave birth. Once it's fully implemented, the campaign will reach the parents of over 460,000 children in Cuba. So overall, in 2018, while over 100 countries are implementing programs on gender socialization, only 36 offices have taken this work to scale. So this is another example of where we know we've made a start, but we know that there's a lot of work to do. This program, like many others that we've talked about here, involves a mix of strategies, including evidence generation, advocacy, communication for development, gender-responsive curriculum development, and others. So those are all the stories that I want to tell you today before bringing up the panel so that you can hear from all of us. But this presentation would not be complete if I didn't give a massive thank you to the many governments and multilateral organizations who have helped us to make a difference in all these areas you've seen here today. Thank you.
Thank you very much. Excellent. I think very interesting. I think very interesting to see this presentation because in some of the discussions that we've had earlier, a lot of these themes have very much been present. The one of how do we leverage the much larger national resources to really fund some of these priorities. So I think the data-driven approaches to increase government investment in some of these critical areas, which Alexandra highlighted, but also how do we increase the efficiency of programming so that we are actually able to do more with the same amount of financing, as was evidenced by the linkage of the cash transfer program with the health insurance. Also, interestingly, in our discussions previously today, there's been a lot of discussions and questions asked about how we integrate issues like gender, like disability throughout all of our programs. So I think we've had a lot of discussions of those already, and hopefully can have some more this afternoon. So I'd like to invite onto our panel, Alex, to rejoin us, as well as Lauren Rumble, who is our Principal Advisor on Gender, Rosangela Berman, who is our Advisor on Disability, and Fabio Frisca, our Advisor on Adolescent Development and Participation. So they will all take their seats there. Very good. Do we have any questions or comments to start with from the floor? If not, we have some that were, I think, came in online. If you could maybe give us an example, and I think you've talked a lot about the different contexts here. How does UNICEF keep a focus on addressing child poverty and discrimination in humanitarian contexts, or contexts where countries that perhaps were stable before, but are moving into areas of increased fragility and potentially a humanitarian situation?
Thanks. This is working. As you can see, this has really been an important priority for us, and I think you've seen that in a lot of the stories that are told, including in the report. You know, I think almost half of UNICEF's funds were now spent in humanitarian contexts. This really and nearly half of those children live in such contexts. So making sure that we invest more and understand how we're going to do this work there is critical. So for us, kind of concretely, one of those areas where we're really focusing on this is social protection, where our work on social protection is now looking at how do you make systems shock responsive so that they can respond, so that the government's own system can respond quickly in the event of a crisis. But we are also at the same time, there's a big switch in the international community towards using humanitarian cash transfers as a first line response, making sure that those transfers are linked up to and help to strengthen existing social protection systems is also something we've been focusing on quite a lot. There's quite a story about that in Yemen that you can also read about in the report. In public finance, we have an ongoing training for our staff members around the world, and this keeps coming up. So what do we need to do on public finance in humanitarian contexts? And the idea of looking at issues like contingency funding, about having budgets that are held back to respond to crisis, is just one of the many ideas that has come up. But it's something that we will be exploring more and more. And finally, and before passing to the other panelists on this, because I'm sure they'll have plenty to say, as they should, is that I want to come back to the previous panel where my colleague Mariah, who's part of the social policy team, spoke to you and mentioned our work on peace building and disaster risk reduction, where we collaborate with colleagues across the organization, but especially with colleagues working on humanitarian issues. Because the work on local governance is taken forward through our social policy, often through our social policy work, and involves working with these local authorities who are the ones in a position to act, and indeed in a position to identify who needs social protection, to plan their budgets in ways that can best respond, to involve adolescents in peace-building initiatives. So all of those are critical parts of our work.
Excellent. Very good. Do you want to pass on for other comments?
Yes, for the area of disability, social protection is critical too, because it allows us to not only increase or to reduce the extra cost of disability for any family, and also to provide services that normally are not available in society, in the community. For example, provision of assistive devices and even access to education. We have been seeing this happening a lot in different countries. Even with no conditionality, you can make sure that in emergencies and in development, children with disabilities have more condition to participate in society. So we really believe that a good thing that we are having now with results on disability in 2018 is to be able to strengthen our relationship internally and externally with the governments on disability, social protection, gender, adolescents. So I think that we are in the right track.
Excellent. Rosangela, I'm going to keep you on the spot because we had a recent discussion about how you felt that the disability programming in UNICEF was at a tipping point and that we'd laid a lot of the foundations and now we're really ready to accelerate and scale. Do you want to say a few words about that?
Yes, we have, well, actually, from the results we got of 2018, first time that we had measurable results for children with disabilities, 123 countries reporting disability, 59 countries reporting an inclusive humanitarian action as well, and assistive 66 million thousand assistive devices being distributed, and many results in other areas that we now can measure. We are engaging in partnerships that allow us to really start scaling up work on disability. This year, 2018, we reached out to 1.4 million children with disabilities, but we can go much, much, much beyond this. And now we have the capacity, the knowledge to do so. We still need to build the capacity in country level. Right now, we are engaging, for example, on a global partnership on assistive technology, meaning wheelchairs, crutches, hearing aids, etc., that can take us to provide by 2013 500 million pieces of assistive devices in the world in partnership with DFID, Norway, USAID, and WHO. So how to use our supply division, for example, to be able to scale up, and we have this capacity in how we need a bigger focus from donors to understand that that's the way to reach the most marginalized and leave no one behind. UNICEF is ready to this, and we want to continue discussing about investment in the area.
Excellent. Just turning back to the group here, if there's any issues or comments, questions. Tony?
Thank you. This is excellent work, and we're also interested in it. I'm just trying to understand, as a relatively newcomer, when UNICEF reports that 55 countries report child poverty, or 123 countries report with disabilities, Is that a correct sum, or is that just the countries of the world where UNICEF have programming? Because it's quite important when we talk to the media that we shouldn't forget the 40 countries who are national committees, who are all committed to these same areas and also report into inequity and to PFP these numbers. But I could be confused, but are those numbers excluded in this report which talks about these countries?
Okay, Alex, we'll come to you. I think there was another question towards the back on the right-hand side that I would take now. Or maybe it has been answered. Okay, until I see that hand again, Alex, I'd hand over to you.
Good question, and you got us. You're right. Sorry? Well, what the report is saying is in the work where in the countries where UNICEF is working, these are the numbers who are reporting this. But I want to come to you and challenge you on some of this as well, because there, at the time of that the SDGs were being developed, and we were looking at developing these indicators, one of the things that we found is that the numbers of the countries who were reporting on questions like child poverty or multidimensional poverty were far more likely to be program countries than wealthy countries. Because there has been less pressure to some extent on countries who were left out of the MDGs to report. And so that is actually a challenge that we all need to rise to. I think we all absolutely agree with you that UNICEF is a global organization with a global responsibility, which includes all countries in the world. And finding ways to do that work together is very important. We here at the headquarters social policy team works closely with national committees and with the advocacy colleagues in national committees who work on some of these issues. And we do try and support a little bit programmatically here, but it's difficult because neither we nor they are resourced to do that. And to do that in more depth. But I think it's something that we should certainly work to improve. Thank you.
Excellent. I have another question, and I think that this can go to Fabio. What would you say in terms of, we've heard a lot of the other presentations, a much greater focus on adolescents. So what would you say has been one of the key lessons that has come out of the work in the last couple of years in terms of how we need to do better about working with adolescents to kind of bring their voice to the conversation?
Thank you very much. Yes, definitely in the last couple of years for UNICEF, we have seen a much more focus on adolescents, especially with the arrival of the new ED. But at the same time, this was somehow in the air because we have seen that in general, the narrative in the media with the member states and other partners, focus on adolescents has been increasing impressively. One thing is that we might be victim of our own success in a sense. We are working a lot on adolescent participation. When work increases significantly, quality might suffer. So we as UNICEF are somehow the guardian of meaningful participation of adolescents versus tokenistic participation. So we are working a lot in trying to make sure that the quality standards for meaningful participation remain high. The importance of doing good on this is valid as in any other field, but with adolescent participation, it's even more important because if you don't do it right, it can actually be counterproductive with adolescents, in fact, becoming disenfranchised and even, developing anger vis-a-vis the adults that are not giving them the right space that they would deserve. Another significant gap that we are encountering refers to availability of data. Talking about data, Alexandra, again. There are very scarce data about adolescents. One reason is that when others than UNICEF work on this age, they mostly work on youth, which is 15 to 24, while we work on the second decade, 10 to 19, or more precisely 18, because that is when the childhood finishes. So available data typically refer to youth. We are working on this. We are developing an adolescent country tracker that is gathering available data on adolescents and we are going to launch this before the end of the year, and that will equip countries with statistically significant statistics and data about adolescents. The other thing is very profound, is norm. In fact, in many society, in all society, there are norms that are not conducive to adolescent participation, that are in fact sanctioning adolescents to participate. And within the category of adolescents, of course, we have a breakdown that has girls, adolescents with disability, adolescents from ethnic minorities that are suffering even more of that. We are paying, so on one side, an important advocacy part on this. We are working on social norm. You heard this morning we have a C4D group which is very eradicating our programs and is helping our agenda on social norms. And at the same time, we are having adolescents working on this themselves, because once you start giving them space, they actually are working very forcefully. And I would like to give an examples. Thinking about the most vulnerable adolescents with disabilities. So as UNICEF, we give the floor to adolescents to come up with solutions to problems that they perceive in their society. And we try to be very respectful of what they come up with. And they actually address not systematically things that affect their life, but things that affect the life of the most vulnerable people in their community. So very often they come up with solutions to help adolescents with disability, like in the example that was presented. And a group that impressed me a lot came with solution for the elders. It was in a community where the working class migrated, so there were only the nephews and the grandparents, and they wanted to come up with solutions to help the elders. And another very powerful thing in working with adolescents, and we'll stop there, is the multiplier effect. So when you empower adolescents to take activities that then multiply our work, we have the example in Pakistan where you have been promoting skills for adolescents, mostly around health, and then we had a peer-to-peer approach. And the multiplier was 9. So UNICEF directly addressed 4,000 adolescents, and they in turn reached 36,000 adolescents, which I think is quite spectacular, with meaningful participation in this case. Thank you.
Thank you. I mean, I wanted to also give an opportunity to other members of the panel to talk about norms and socialization. And I think we've heard in other presentations about the most difficult children to reach are often the children that are not counted or are invisible. So if you could give us maybe some concrete examples, we can start with Lauren and then Rosangela in terms of what's some of the work that we do around norms and socialization, in your case specifically to address gender norms, and Rosangela in terms of some of the issues around disability.
Thank you so much, Megan. I don't know if you have access to the clicker, but it might be worth going to the very last slide that Alex presented, where we have a father in one of our programs in Cuba who's benefiting and participating in a social norms program about fathers' roles in families. So let's zoom in on this case study. Thank you, Megan. Sorry, there are lots of clicks in this one. So here's John Carlos, and he's being able to really deliver hands-on care and share the burden of care work and the joy of child rearing with his partner. And this is not a possibility for most fathers worldwide or male caregivers. And why is that? That's because of social norms in large part. We know that these social norms start early. So if we think about the workforce where John Carlos was working, the burden of unpaid care work is predominantly shouldered by women. 76%, in fact, is what the ILO reports tell us from 2018. And these norms about whose role it is to take care of unpaid care work or child rearing starts in early childhood. We know that girls are shouldering 160 million hours more than boys in household chores. So starting very early, Juan Carlos is positive role modeling what it means to raise children as a male caregiver, be a real champion. And also we're hoping that he's going to more equitably distribute household chores within the family between males and females in siblings. This enables girls to go to school, to enjoy their childhood, and really have more freedom in decision making. If we take that change that's happening in the household level and expand our social norms change to the systems, we can work very practically with the private sector in workplaces. And we heard our early childhood development colleagues talk a lot about family-friendly policies. How can we make workplaces where we work as multilaterals, the private sector, for many of you donors and partners, more inclusive of women, safer, free of violence and harassment, making sure there are breastfeeding rooms, issuing policies about paternal leave so Juan Carlos can take that paternal leave. All of that contributes to a broader and global social change movement. So starting very small, we see positive socialization work as a critical part of gender integration work. Without it, we can't change those harmful attitudes, beliefs, and practices that disproportionately affect girls and women.
Rosangela.
Thank you. Thank you. Well, stigma and discrimination against people with disabilities in general is in the center of the causes of exclusion and invisibility. It's present in every single part of society, and it's something very difficult to address. UNICEF is in the best position and is doing already interventions, studies and interventions in communication for development to address this, but we have to do much, much more. This is in the center of our work plan this year. We are already developing a global package on communication for development to combat stigma, to address stigma and discrimination against disability. You have manifestations of stigma and discrimination from family level, community, every service, every provider in the community, even from religious leaders and etc. So that's a critical aspect of our work. We have fantastic experiences already from in Montenegro, for example, when a child with a disability engaged in a fight after being deinstitutionalized. So UNICEF worked with the deinstitutionalization in the country, taking children with disabilities out of institutions and bringing them into the community, foster families. And one of them were provoked by another kid in the community, and this generated a big media reaction of all parents wanting children with disabilities back into institutions. And this, you can imagine what was the impact of this, with a big responsibility in the hands of UNICEF, which started immediately to put together social norms or a behavior change campaign in the country, and could change the behavior of these parents in the 4-year period from zero acceptance of children with disabilities living and studying with their kids in the society to 80% of acceptance. So this kind of work we need to do much more in every country, and we need to build that capacity in governments, partners in general in the community, and in UNICEF ourselves as well. So that's a critical work that we have to do, again, related to disability and adolescents, gender, children, and everybody. I remember, short story, when I had my car accident, I was 18 in Brazil, and engaged in the movement immediately there. And there's a story that really marked my life. That was, I was walking there in Copacabana with my wheelchair, pink, all cool, and a beggar, a woman, lady, old person begging on the streets looked at me and she said, "What a pity, so pretty," you know? She wanted to say, how come someone that is pretty and young can be so unfortunate in life, right? So I think that it relates to all of us in so many aspects. So she was really feeling that in some way I was in a much worse position than she was. I don't know where she is right now.
Alex, do you want to comment on this, and then I'll come back for our last round?
Sorry, you're going to have to remind me what the question
Oh, sorry,
was.
we were talking about the whole socialization of norms, etc.
I think for for our area of work, a lot of it goes back to maybe let me say that the socialization actually then impacts on child poverty. So the story that Lauren was telling, for example, the stories that Rosangela is telling, impact on people's ability to actually become productive members of society. The more people that we exclude, the less likely we are to see economies develop, to see them be able to lift all boats. This is a story that we're in a discussion that we're increasingly having with the World Bank, with their Human Capital Initiative, as well as with the IMF, who are now focused more on social safeguards, and that's a discussion that we will continue to be having with them, including in a few weeks' time when the ED addresses the IMF board. It's an example of how all of these areas are interrelated. I struggled for a moment because our specific work on social protection, our specific work on child poverty may not take on those issues so directly, and yet those issues impact on the success of the overall outcomes that we're trying to bring about. I mean, of course, social protection work does as well. Maybe just to briefly mention that an important part of our social protection work is to link these the vast majority of social protection interventions that one thinks of are about income replacement kinds of benefits. But there's also work that connects people to services, and that includes social welfare services, includes the opportunity to be able to have access to social support. Those support services then help make the possibility for different gender norms. One of them, maybe the last one I'll mention, perhaps the most concrete, is around childcare. We see that the expansion of access to childcare as an integral part of successful social protection initiatives around the world. And that in itself will both help with the social protection economic side of things and, of course, help with positive socialization.
Excellent. Thank you. A last round of questions. Any questions from the floor? I can stand here uncomfortably until we have a question from the floor. I'm brave. Okay, fair enough. Right, then I will close out this. I think a couple of very interesting points of discussion that have come out and important to reflect upon in terms of the universal agenda of the SDGs. And so all of these issues in terms of child poverty measurement being important to be reflected on both for countries that are developing, but also for industrialized countries. And I think an important point that was made on participation, but also in terms of socialization and norms, is that those, for instance, adolescent participation can then become a driver of those priorities for adolescents. And we had a discussion a couple of sessions ago in terms of climate change. And we really are seeing when the voice is being given to adolescents that they are then part of the galvanizing force to really bring more focus on climate change. So I wanted to thank all of the participants for this panel, and also just to emphasize that the data and the case studies that have been put together in these reports, I think, reflect the work of UNICEF, but also reflect the work of the governments and national committees that are here today, as well as many others. And so what we want to do as a next step to this area of work is really to be able to package the information in terms of the results that have been achieved, because we know that you all have constituencies in terms of your general public, in terms of your parliament, and they all have an interest in understanding how aid and the pursuit of child rights can be done in a way that's efficient, in a way that shows results. And so we're committed to making sure that you have those materials and products to be able to continue to engage in that dialogue with the constituencies that you have back home that are important to furthering this agenda, both in terms of advocacy to keep these issues on the agenda, as well as in terms of resourcing to continue the progress, but also to address some of the gaps that have been identified. I am told that we have coffee. Thank you.